to our first session with our fabulous Five Rivers Health Center's providers who are going to be helping us to survive and thrive during COVID-19. I'm Gina McFarlane-El. I'm the CEO of Five Rivers Health Centers. And today I'm pleased to say we have Dr. Mamle, Anim, our Chief Medical Officer, who has over 30 years of experience as an internal medicine physician. Welcome.
Thank you. Thank you, Gina.
Dr. Anim, we're all bombarded with all different kind of myths about COVID-19. What myths would you like to debunk today for our patients?
All right. So, hello, everybody. The first myth I want to debunk is that COVID-19 is real. This is a real infection, and it's infected. Now, over 1 million people in the world have lost their lives. So it is real, it is impacting people, and we should take it seriously. It is not a fake virus. The other thing I want to debunk is that masks do work. A lot of people don't want to wear masks because they don't think it makes a difference. Masks do work, it makes a difference. Following the CDC guidelines do work. Avoiding crowds, isolating if you're sick, and then good hand washing protocols will help reduce the infection and transmission of COVID-19. The other myth is that young people are not immune. Young people, children can get COVID-19. Unfortunately, we've lost children across the country with COVID-19, so they are not immune. And then young adults can also get it and can get serious disease. So the truth about COVID-19 is anybody can get it, everybody can get it. We just don't know how serious it's going to be. So the best thing is to not get it. So following the guidelines is really critical.
Please help our audience understand a little bit more about testing. We hear talk about antibody and antigen testing. What's the difference between the two?
Okay. So there are actually 3 types of COVID-19 testing. You said antibody, antigen, and then there's also the PCR, which is a genetic testing for the virus. I want to start with the PCR because that's the most common testing out there, at least in our community. So the PCR is the one that you go in and they get a sample from in your nose all the way up there. They are looking for bits of the virus. So they're looking for genetic material of the virus, finding that, and if it's present, you're positive. So this is a pretty specific and sensitive test for COVID-19. You have the virus, they found a bit of it in there, you're positive. So that's the PCR RNA. The antigen is your body's reaction to having the acute infection. So it's also still a nasal swab, but they get that sample and they're looking for your body's building sort of the beginning of the fighting tools against this virus. So it's not finding a piece of the virus, but it's looking for a piece of your body's response to actively having that infection then. So that's the antigen. The antibody is something that develops later, and it's really evidence that your body is saying to people that I have had this virus in the past. So the antibody test is really not to say you have it now, but it shows you've been exposed to it and your body has reacted to it.
Thank you. Okay, so how can we help our patients survive during this pandemic? What are some helpful hints that you'd like to share with our patients?
So yes, like Gina said at the beginning, we want to survive, and we actually want to go beyond that and thrive during this period in our lives. So I want us to focus on things within our control. There's so much about COVID-19 that's out of our control. You feel helpless, you feel like today it's this, tomorrow it's that. So what can you do? First thing is to follow the CDC guidelines. That's just basic. Wear your mask, avoid crowds, hand hygiene, isolate if you're sick, try not to get it, try not to spread it. So that's critical. We all need to do that, and I think if we all did, we would be in a better place. Then focus on what you can do. You've all heard being diabetic, being obese, having diabetes, asthma, all those COPD, all those things make you at higher risk for complications when you get COVID-19. So what you can do right now is focus on your own wellness. If you're diabetic, make sure that you're working with your provider, getting your blood sugars under control, taking your meds, keep your appointments, get your meds adjusted. If you're COPD, make sure stop smoking or reduce smoking. I mean, work on things that help you so that if you should get the virus, you are ready to fight it better. So that's within your control. Stress management. This is a very stressful period for all of us. So trying to do things that bring you joy. Spend time outdoors, spend time with family, whether it's virtual or face-to-face. Spend time with people you love, do things you love to reduce your stress level. And at this time of the year, we can still spend time outdoors. Let's do more of that and get, kind of get our zen going. A lot of people have mistaken social distancing for social isolation. I think we need to realize there's a difference between don't isolate, distance, but still continue to maintain relationships. It's critical.
Great, thank you. During this pandemic, we've also faced great racial upheaval. We've all learned that COVID-19 impacts people of color, especially African Americans and Hispanics, disproportionately. What is some advice you'd like to provide to our patients to survive again and hopefully thrive during this time period?
So I think it's really important that we get into a self-preservation mode. We realize that all these years of health disparities that we've been talking about have really, really festered, and it's really become manifest in this COVID-19 era that certain populations are not doing as well because of disparities in our system, disparities in diseases and the care that they receive. So we need to really self-preserve in that, again, as I said, if you have conditions that put you at risk, work on it. This is the time for you to say, I'm going to get better, I'm going to do better, so that you reduce your risk. We also need to work on the systemic issues that have caused this problem to even happen. And I'm hoping that, it's all over, the health disparities, racism has been it's now a public health crisis. And so now I know that we are working on it as a country, as a health system, and I'm hoping that we come out of COVID-19 actually better for all of us. If you have to work in a high-risk environment, follow all the guidelines. Speak up when you're in an unsafe situation. If somebody's too close, if something, just speak up and make sure you're wearing your mask, protect yourself. I had a patient whose son had COVID-19. They lived in the same house, but they were able to follow the guidelines within the house, and she never got it, even though he had the infection. So focus on what you can control so that you can make yourself better.
Great. And the last question, what resources are available through Five Rivers Health Centers to help our patients with COVID-19?
So we have telemedicine visits, so we can see you by phone or by telephone. Because we still have patients coming to our facility, and some of them fairly vulnerable, we do try to avoid having patients who could potentially have COVID-19 come into our buildings and spread it. So having said that, if you call and you're at risk, we will take care of you. If you call and you're at risk and you have to come in because something critical, we prepare for that. We will make sure that you're isolated, wear the full personal protective equipment, but we do try to avoid that as much as possible. We have followed all the CDC guidelines. We've spaced things out. Our waiting area is not, we don't allow it to get crowded. Chairs are out. We will register in your car. We will let you wait in your car, go straight to the back of your room. We clean rooms in between patients. So we are doing all the things that we need to do to reduce the spread while taking care of our patient. The amazing thing is Five Rivers never stopped taking care of patients. Right from March when everything shut down, we found a way to start telemedicine like within a week and keep seeing patients and bringing them in if we needed to. So we have continued, I'm proud to say, to do what we've always done well, is taking care of people.
Thank you so much for this information. I know I've learned a lot, and hopefully our patients will learn a lot too as well. So please join us for the next time when we have one of our other providers who will discuss COVID-19 and your pregnancy. So thanks for listening, and please be safe out there, and we look forward to all of us surviving and thriving during this pandemic.